One of the vulnerable and diverse populations in the United States is the Pacific Islander population. The Pacific Islander population suffers from a variety of health problems and disparities. It is up to us to work towards better helping underserved populations such as this one. Pacific Islander populations incorporate many cultures and languages. Each individual has a unique approach needed for healthcare and treatment. The Pacific Islander population is split into Melanesia, Micronesia, and Polynesian cultures as illustrated in this slide. Although this is a small population, they are susceptible to many diseases and vulnerabilities. Utah has a greater number of Pacific Islanders than most other states, ranking 5th, and is responsible for providing health care. Utah is made up of 1.2% Pacific Islanders. One way to reduce disparities in this population is to promote healthy pregnancies through safe sex, prenatal care, and birth spacing. This will be important as it can improve economic status, physical health, and fetal health among Pacific Islanders. In fact, the Mahina pilot program launched in Utah was a culturally appropriate program to teach Pacific Islanders to practice prenatal care, exercise, and birth spacing. The program was effective at teaching Pacific Islanders located in Utah during the program. In the Pacific Islander population, there are high-risk sexual behaviors among adolescents. The issue is of concern in all races in the United States, but in the Pacific Islander population, few adolescents seek treatment for STDs and misreport their sexual history and disease history. Pacific Islander youth are less likely to get STI testing, mostly due to cultural pressures. Healthcare workers should encourage private STI testing to all ages and races. Early testing will allow for better treatment and health overall. One of the greatest disparities is the ratio of tuberculosis in Pacific Islanders and compared to non-Hispanic whites due to low socioeconomic status, crowding, diabetes, and diseases that lower immune systems sets the stage for tuberculosis to set in. Multi-drug resistant tuberculosis is a type of disease that is resistant to the two most powerful anti-tuberculosis drugs, mainly rifampin and isoniazid. This disease is common in Pacific Islanders and is even harder and more deadly to try and treat, making prevention a priority. Pacific Islanders are also more susceptible to diabetes, which in turn can cause other important comorbidities to watch for. Some other comorbidities are heart disease, obesity, and lung diseases among this population. In fact, to emphasize one of these comorbidities, 44.6% of Native Hawaiians and Pacific Islander populations are obese. This requires specific medical attention and understanding when treating this population. Each individual will be different, but it is important to watch for this comorbidity. It is wrong to assume that every Pacific Islanders has diabetes or obesity. Even if the population as a whole is more susceptible, each individual is different and it is important to not assume. Some individuals may not suffer from typical morbidities or any morbidities. One of the root causes of the high obesity rates is westernization. When Pacific Islanders were introduced to the Western diet and lifestyle, the colonization occurred when people from the United States came over to the Pacific Islanders and vice versa. This is where they were exposed to our diet. To compare the Western diet, high intakes of red meat, processed meat, prepackaged foods, butter, candy, and sweet fried foods, which starkly contrasts with the Pacific Islander original diet, which is low calorie and lower fat foods that are nutrient dense. What increases the concern with treating Pacific Islanders is the fact that Pacific Islanders are more likely to be uninsured, which can decrease the likelihood of receiving prevention treatments or going to treat a disease, whether an acute or chronic disease they may have. When treating these Pacific Islanders, it is important to understand that they have a more holistic, balanced view based on their health. They believe that mental health, social health, and physical health all work together and can influence diseases, even spiritual health, which is important to be mindful of. According to a 2019 study of 223 Pacific Islanders, the prevalence of major depression, generalized anxiety disorder, and alcohol use disorder was 21%, 12%, and 22% respectively, compared to the 6.8%, 2.7%, and 3.1% in the general U.S. population. To help reduce some of these disparities, vaccinations, exercise, and a healthy diet are recommended for all populations and Pacific Islanders especially. This will help improve the overall health of the individuals in this population and any other population, as everyone benefits from these three things. Since Utah has the 5th most common amount of Pacific Islanders, special attention is needed to regulate the pregnancy habits, sexual activity, diabetes, and tuberculosis of this population. Healthcare clinics and public health professionals, along with healthcare workers, can work together. Remember that every person is different, which is important to help healthcare workers understand how to serve every different Pacific Islanders. It is important to develop cultural competency and know what risk factors to watch for in every single individual and population. Thank you for your time.